This next one's kind of nice. I always tell my medical students that it's not just the patient that you're talking to at the moment with his or her obstructive sleep apnea. It's very commonly about 75 to 80% in my practice. A bed partner also almost as impacted in terms of his or her poor quality sleep also. And so this shows that 83% of bed partners prior to an Inspire implant being placed reported severe snoring that disturbed their quality of sleep. And then after the implant, reduced to 10%. So an 88% reduction in snoring. I always think to myself that the 17% that didn't report the snoring are probably patients that or partners that were not sleeping in the bedroom to report their partner's snoring